Hello, good evening and assalamualaikum to all kaki wakla, to all the attendees tonight. How are you guys doing? Okay, are you guys doing great? Right, doing very good, right? And I hope you guys, number one, you guys have done your exercises and also have eat your dinner, right? Okay, excuse me. Okay, so tonight we'll be talking about prostate cancer and exercise. Okay, so one is about disease and one is about physical activity. How can exercise help or support patients with prostate cancers? All right, so without further ado, okay, let me put some comment inside the YouTube. Okay, one put some questions. Have you guys exercised today? Okay, I want everybody to answer this question, and by the end of the session, I will read one by one. Okay. All right. So let us start with the sharing. Okay, I don't call this as presentation because I want to share with you guys. Okay, what is prostate cancer and what exercise can do to help patients with prostate cancer. Okay, so here in the first slide, it shows the normal prostate and prostate with cancer. Okay, as you can see, the normal prostate is quite normal. Okay, it looks like a shape of a fruit. Okay, and on the other side, it looks like an enlarged fruit. Okay, so let us see what is cancer. First thing, what is cancer? Okay, a lot of people talking about cancer this, cancer that, that is cancer, that is cancerous. So what is actually cancer? So number one, sorry, I'll talk about the prostate first. Before we go into the cancer, we go into the prostate. So what is prostate? So number one, prostate, as you can see in the picture here, or if you can see my cursor moving, okay, it is a gland shaped like a walnut. Okay, so what does it do? It makes seminal fluid, and the liquid in the sperm, the liquid that protects the sperm, supports and helps the transportation of sperm. Okay, so that is the function of the prostate, and you can see the picture or the image of the prostate on the image that I've shown in my slides. So what is cancer? A disease characterized by the uncontrolled growth and potential spread of abnormal cells. Okay, so it may sound a little bit scientific. Let me break it down to you. So our body, a normal human body, will generate new cells, 1 billion new cells every single day. So how they generate? They will divide the cells into two and create a new one. So what is cancer? Okay, so cancer is a thing that create an abnormal growth or abnormal division or abnormal creation of these new cells. So it becomes abnormal, it becomes very, very high until it creates a tumor inside our organs, our glands. Okay, so that is cancer. So cancer is something that is growth or growing abnormally inside our body. So when you see this prostate cancer, it will have a tumor inside. Okay, see stage one, just focus on the right image. Okay, so stage one, there will be a small tumor like the size of a peanut, and stage four, it can grow until the size of a walnut. Okay, you see, so the prostate itself, the size of the prostate itself is as big as a walnut. So, but the tumor also can grow until the size of a walnut. So what does it do to your prostate? It would enlarge your prostate, okay? It will. So I'll go back to my first slide. I want to show you what does it do to your prostate. You see, it will compress your urethra. So urethra is the tube for you to pee, okay, where the urine will go through the tube, okay. So when it is enlarged, it is hard for us to pee. The urine is, it is hard to flow through the urethra, okay. So let's go to the next slide. So what are the sign and symptom, risk factor, and complications when you have a prostate cancer? So number one, we go to the sign and symptom. As I said just now, when you have something cancerous inside your prostate, it will be enlarged and narrowing down the urethra. So you have difficulty in urinating, low stream of urine, and frequent urination at night. Why? Because you are unable to control your micturition, or you cannot control your urination, okay. And we will have constant need to urinate, this is the same, okay. Dark reddish urine because of the blood. The cancer will actually like when it becomes too large, it will create some kind of like a tear inside the urethra, okay. Weaken or swollen the lower limbs, yes. And one more is back pain. So the sign and symptom will show around your hips, you see. The symptom will show around your hips. You will get back pain, okay, weak and swollen lower limbs, okay, from hips to lower limbs. So what are the risk factor? Number one is age, okay. As you age, the risk for you, or for men, okay, especially, will increase as you age. And for race, in America, okay, later I'll talk about Malaysia, African American has the highest risk to get this prostate cancer. And in Malaysia, we have Chinese to has the highest risk of getting this type of cancer, okay. Family history and also lifestyle factor. So if you have like a family who actually have or develop this prostate cancer, you might as well have that same risk to have a prostate cancer, okay. And I will focus on lifestyle factor. Later I will go into that, okay. And complication. What complications for that the patients that have this cancer will have, okay. So number one, spreading of cancer. Yes, the cancer itself can grow inside the prostate, but the complication is spreading. So it can go to the other organs besides your prostate, okay. It can spread into other organs around the area, okay. Number two, unable to control urination. Yes, it is inside the symptom also. And number three, it is the most unfortunate thing that happened to a man, okay, which is erectile dysfunction. You cannot erect your penis anymore. That is one of the complications, okay. It maybe seems like funny to you because we are not those patients. We are not those who are having this type of cancer, okay. But yes, it is so unfortunate for them, okay. I feel very sorry for them who have this type of cancer. Okay, so when we look into lifestyle factor, okay, I'm focusing on obesity. So obesity and prostate cancer, there are few studies that actually have shown that leptin levels among men with prostate cancer, okay, and when they have high leptin levels, they will associate with larger tumors. So number one, what is leptin? So leptin is a type of I say chemical or hormone that induce your hunger, that increase the feel of being hungry, okay. And when that feeling and when that hunger increase, okay, when that hunger is high in one human, okay, it shows that it is associated with larger tumors. So people with high hunger, talking about people with prostate, okay, they tend to have a larger tumors. Okay, this is in a study by from PubMed, published in PubMed. You can see my reference down there. All right. So next, maintaining a healthy weight is important for good health in general and may help prevent dying from prostate cancer. So when you guys actually eat well, you eat mindfully, you know what are you eating, you might, number one, it is good for your general health. Okay, it is the most important thing. And it may help to prevent us from dying from prostate cancer. Okay, so, and down here we have few studies of obesity and prostate cancer incidence and survival. If you guys are interested in obesity and prostate cancer, okay, of lifestyle of people who are having obesity, you can comment down below in the YouTube section, in the comment section, and I will drop down the reference. So what are the treatments that they usually give to people who have prostate cancer? Number one is anti-androgen therapies. Okay, so before I talk about what are the side effects, what is actually anti-androgen? So in prostate cancer, okay, and in a human, we have a lot of hormones, right? But mainly in what makes the man is the testosterone. So this prostate cancer actually can grow and grow larger, increase faster and increase more in number when there's the presence of what we call as testosterone. Okay, so these anti-androgen therapies actually they will give you some pills. Okay, some doctors will give pills, some doctors will jab. Okay, and they will reduce the production of your testosterone. So what are the side effects? Is loss of muscles, bone mass, increased central adiposity, which is fat, and body fat. And other studies also shown that it can also affect their mood and also affects their level of energy. So maybe because we know man is a type of human, okay, other than female, only have two. Okay, so a male will actually have more energy than woman, because we in life, man needs to work, and God created man with higher energy, have to do a lot of works, put the food on the table. So the anti-androgen therapies will actually reduce the energy for men. So we don't want that to happen. Okay, but unfortunately, that is one of the treatment that they give to the patients. And number two is chemotherapy. This is the most famous one for cancer patients. So the side effect will be fatigue, physical impairment, develop of neutropenia. So what is neutropenia? Neutropenia, okay, is a neutrophil. Okay, this came from the word of neutrophil, a type of white blood, in our body, white blood cells. Okay, it will decrease lower than the normal level. So that and when you know what blood cells do to your body or not, okay, it is actually protect your body from the inside of your body. So if you have skin, okay, skin is the barrier from outside. So our white blood cell actually protect our body from inside. Okay, and exercise mitigate cancer related fatigue. So we will focus on exercise today. Okay, it will restore your physical function, enhance physical fitness. Okay, so let us see what is actually physical activities. So there are two types of physical activities. Okay, number one is sporting activities. Number two is exercise. So sporting, as we know, it is uncontrollable. Okay, like you're playing badminton, you're playing tennis, you're playing futsal. Okay, so in other words, you can put as sporting as a competitive physical activities, and exercise, which is the controlled physical activities, which is aerobics, resistance exercise, and stretching. Okay, so we can see the difference between this, because sporting, like I said just now, can put it as a competitive, and exercise is non-competitive, just to improve your body. Okay, exercise. Excuse me, right? So next, so resistant exercise and dosage. Okay, the mechanism of the repetitions, right? So, well, usually when we go to the gym, when we heard about people lifting, they will ask you, how many reps did you lift just now? Okay, how many reps did you do? Okay, so let us see what actually the repetition means in the strength exercise, okay, or strength training. So 1 to 3 repetitions is for your neural pathway. 3 to 5 repetitions is for your strength. 5 to 8 repetition is for you to build your power. 8 to 15 repetitions is for muscular hypertrophy, to enlarge your muscles. Okay, and 15 and above repetitions is for the endurance. Okay, so I hope that clears. I mean, people are asking, oh, how many reps you do, how many reps you do. So this is the science behind the repetitions. So how exercise affect prostate cancer patients? So we're going into the effect of exercise in prostate cancer. First, can adverse effects of hormonal prostate cancer treatment, such as the androgen deprivation therapy, okay, the anti-androgen thing. Okay, so we know the effects as well. Fatigue, okay, we have low of energy. Okay, so number one, it will improve your heart health, your bone density, it will increase your muscle mass, prevent obesity, decrease in blood sugar, okay, which can so I cannot see my words. Okay, so when you decrease blood sugar, okay, it's then lower insulin and lower in inflammation levels, and lastly, reduce fatigue. Okay, so beside these physiological things happening in our body, it's also it can also effects in the psychological way, which is reducing stress, anxiety, and also depression, and reduce the aggressiveness of prostate cancer. Okay, so let's hear why reduce prostate cancer. Exercise prescription. All right, so the exercise prescription, I will talk about the why, what I told you guys just now. Oh yeah, the aggressiveness of prostate cancer. I will talk about that in this exercise prescription. So exercise volume for patient with prostate cancer is repetitions will be not more than 6. Number one, because we don't want our body to increase in testosterone. Okay, so 1 to 3 just now is for the neural pathway. So it will increase the coordination of our mind, of our brain, and also our muscle, the intermuscular connection. Okay, so 1 to 5 is the best for prostate cancer patient, because it will not increase the number of testosterone in your body. Okay, it will not produce more testosterone, because as you increase or you induce the testosterone in your body, it will the cancer inside our body will become more aggressive, as it has the food for them to grow. Okay, so number 2, frequency, just 2 to 3 times a week, and the duration is 30 minutes, and 30 minutes of aerobics and resistance training. 30 minutes aerobic, 30 minutes resistance training. Again, you can choose, right? And the intensity is low to moderate, right? So what are the precautions when we are dealing with prostate cancer patients? Number one, make sure that they have the medical clearance from either their oncologist, cardiologist, or general practitioner. Number 2, repetitions of exercise. Make sure that they will not more than 6 repetitions. As I mentioned just now, we don't want the testosterone to increase in our body and make it worse for them. Number 3, patients with bones metastasis, okay, use exercise that avoid directly loading skeletal regions, and especially vertical loading, okay. Don't give them such as squats, okay, so that will increase the risk of them, because they are having a brittle bone, because their bone density is decreasing because of their treatment or their therapies. Okay, and beware of fracture risk. Okay, this is what I mentioned just now. Because of the therapy, they have their muscle mass is depleting. Sorry, there is decreasing. Their bone density also is decreasing. Exercise programs should be individualized based on the assessment. So this goes to every patient, and for every type of disease, the exercise program should be individualized, and especially for cancer, okay, it cannot be like, okay, this A and B is the same. No, it must not, okay, must not be the same. It will have to be individualized. Okay, that is the end of the presentation. Okay, the end of my sharing. If you guys missed out anything, or did I talk too fast, you guys can just ask me any questions. Okay, I will go through my first slide so you guys can see. Okay, right, so let's see the comments in YouTube. Okay, great. Hello, assalamualaikum, waalaikumsalam, good evening. Have you guys exercised today? Yes, I'm the one who asked that question. Okay, is it fatal as like other cancer? Oh, yes, prostate cancer is fatal, okay? Because as I mentioned, this cancer use your testosterone. So as a man, that is your main hormone. That what makes you a man, okay, having testosterone. So when this testosterone level, let's say this person, okay, I'm making a scenario, a person that has not been diagnosed, they don't know that they have this type of cancer, okay. Actually, it is every cancer actually grow with the help of this testosterone. So let's say that this one unfortunate guy didn't been diagnosed of having a cancer, and he is a like exercise enthusiast, and he keep exercising, and when the sign and symptoms came to him, and maybe it is too late, okay, it has grown large, okay, maybe the tumor has grown large because he is an exercise enthusiast. So it is fatal like other cancers, okay. A cancer is a cancer. Good. I see so many people train today, and Ethanology, I think his name is Ethan, he trained his back today. Very, very good. Okay. So I want to make it a point of exercise is so important now in our daily life, for our general health, for people who have any kind of disease. It is so important because of the human evolution. I don't talk about not human evolution, the evolution of the world. Okay, as we get technologies, it makes us more, it'll make us walk more. Okay, Food Panda, Grab Food, help us to grab the food for us. We are not cooking them. We are not going to the hypermarket, supermarket to buy things. We are not walking anymore. We are not exercising anymore. So human physical activity is become, it is decreasing day by day, year by year. Okay, so it is important for you to exercise. So please make it a point for you guys to at least exercise 30 minutes not every day, every week, 3 times a week, at least 3 times a week of 30 minutes of exercise. Okay, and you guys here as a kaki walkla, okay, I'm very sure that you guys are aware of this. So let's spread the word to the other, other people, your friends, your family. that has not joined this program, okay, make them aware the importance of exercise. Okay. All right. Now I will wait for questions. Okay. I'm looking at my YouTube. Okay. So I'm waiting for questions. Right. Great. Okay. I will take another 10 seconds. Oh, just done. This question. What kind of food should I avoid? Okay. And so as we know that there are a few types of food that is, this is not cancerous. It can induce the cancer. Okay. So number one, which is the most famous food that we know, okay, is the best part of our food intake, which is MSG. Okay, the what we call that? How do I put this? I don't know, the one that make our food flavorful. Okay, that MSG inside our food. So please avoid your junk food. Okay, please avoid your snacks. Okay, so that are the few types of food that you should avoid for cancer. Or anybody in this room here has any other food that they would like to share? Okay, what kind of food that a cancer patient should avoid? Okay, if you guys have something to share or to add on cancer, please do. Okay, we are here to share our knowledge. Okay, so good question from Nila. If the person have this condition, do they need to get rid of it? Okay, first of all, yes, because cancer is, like I said, is an abnormal growth of cell in our body. Okay, so one way to get rid of it is with the therapy that has been shown just now. Okay, chemotherapy, androgenes. Okay, so please refer back to your oncologist, okay, which is the specialist for cancer. Okay, and they will give you the right advice on what to do and how to do it. Yeah, there you go. Avoid cold food. Thank you, Ethan. Okay, so I 6 reps done in 10 seconds, 6 reps in 40 seconds. Does it has the same physiological effects? One more, may I have the examples of exercise that does not have vertical forces in our bone? Sure. Okay, so number one, the question from Raja, 6 reps done in 10 seconds and 6 reps in 40 seconds. So let's just put this way. Okay, our muscles will not know how many repetitions that you are doing. Okay, and what kind of weight that you are lifting. They only know that you are putting some resistance on the muscle and the time under tension of the muscles. So yes, the 6 reps done in 10 seconds will have different physiological effects than the 6 reps in 40 seconds. Okay. May I have examples of exercise that does not have vertical forces? Okay, so we have 3 types of exercises. Number 1 is resistance exercise. Number 2 is aerobics exercise. Number 3 is stretching. So stretching is one of the exercise that doesn't have any vertical forces on the bones. Okay, so you can try PNF stretching. You can go into active stretching, which is good for your mobility. All right. and also you can go for the normal stretching. Okay, so stretching does not have vertical forces on our bones, because we are simply not putting any force on during the exercises. Right, thank you very much, everybody. The clock has shown 9 p.m. sharp. Okay, so this is the end of this session. We'll meet again next week. Thank you very much for joining, and thank you for sharing. Right, good night. Assalamualaikum. See you guys next week. Thank you.